All right, well, how about this story today? Big news in the fight against cancer. It is a blood test that can locate a single cancer cell in your body in the middle of 1 billion healthy cells. Joining me now is Dr. Stephen Gardner. He is, of course, from New York Methodist Hospital. Good morning, doctor.
Good morning, Martha.
Good to see you. You know, we've been chatting about this in the break. You think this is a huge, huge breakthrough.
It's amazing because it's not only going to change picking up the tumors earlier, but it's going to gauge how we're treating it. So people that are going through multiple treatments that would have had to wait a month or 2 months for a CAT scan, the next day after treatment can get the analysis of the tumor cells.
All right, so take me through. So you said, you know, you'd go in for a mammogram and you'd also get your blood test as part of your annual exam.
Right. You need 2 teaspoons of blood. You take this blood and you run it over like a toothbrush. Think of a toothbrush with the bristles on top. They have 78,000 bristles. You run it over. Only the tumor cells stick to the toothbrush. The normal cells go away. You then take the cells off of the toothbrush and take a look at it. You can see how it works, so you can figure out treatments, how to fight it. Now what we're doing is fighting tumors not as a group, but specifically what type of tumor do you have, what's the best treatment for it. We'll be able to have the cell in hand now and see what it is.
So do they then remove the cancerous cells, or do they just go after them within the body?
They just go in the blood, and they say, okay, this is the type A cancer, this is how we're going to treat it. They give the treatment. The next day you can come back in, see if there are fewer cells, and see what the cells look like.
Well, this is something that I asked you when we were talking earlier, and it raises the question, you know, do you get false positives? And then you're being treated for something that was not a cancer cell at all.
You get false positive with the current system, with biopsies now that are often ineffective, are not enough cells to gauge. This is very, very specific. You're looking at this one cell that's part of a bigger tumor, but you're getting the ability to look into it and see what type of DNA it has, what type of genetics it has. And many of the treatments that we use don't work, so you have to devise treatments that work specifically.
So sometimes your body's basically being assaulted by all these different treatments, and it's not actually killing the cancer in your body.
Right. And also, sometimes you get faked out. Like, there were 100 patients with prostate cancer. When they had this test, 66% of them found that there were cells floating around, which means the tumor had begun to spread.
So they had been treated, they thought they had been successfully cured of prostate cancer, and then they were tested, their blood tested, and it was determined that there were errant cells in their body.
So now you go back, you treat those specific cells knowing what they are and why it failed in the first place with a different treatment.
How long before you see this becoming part of every year's checkup for all of us?
Well, in 6 months, the major cancer institutes, at least 6 major cancer institutes like Sloan Kettering are going to be doing tests. Probably another 2 years away to do it, but you can get into trials. So ask your doctor if you want to get into this study, to get into trials, and ask about this amazing way that we're going to change the way we treat cancer.
It sounds like a true breakthrough, and you're clearly very excited about it, and I know that you don't jump on these things that easily.
I never get excited, except Bill Hemmer New Year's Eve.
Exactly. Dr. Gardner, thank you.
Thanks.